Assalamu alaikum. Thanks you, first of all, thank you so much, Dr. Samer, for perfect presentation to introduce my topic today. Today I'm going to speak about the botulinum neurotoxin TMD insight. First of all, you do a perfect job regarding to the research and regarding to the anatomy and patient selection and how we can use this to relieve our patient. This is very, very important and very beneficial issue we do it to our patients. You start with anatomy and patient selections and introduction, very excellent introduction with together with evidence based. Now I'm going to speak about the what's the techniques and complications and what's the material exactly you are going to inject for our patients. Before we start, I'd like to introduce myself. My name is Islam. I am oral maxillofacial surgeons. I have membership from Glasgow and fellowship from Ireland. I work as a consultant oral maxillofacial surgery. Before I start, I have to declare I don't have any conflict of interest in these lectures, and I take the consent for photography. I'm going to speak about the material itself before I start. Very important to know that Botox material is very safe regarding to the material, but the problem it's come if you are going to do improper techniques in injections. So it's very, very important to know what's the materials. This is very important to sell it to your patient and to convince your patient before you start to do the job. What's Botox? Botox, it's a commercial name. Botox is a trade name for purified proteins. The name it's called botulinum toxins. Okay, let's do step by step. Botulinum toxin type A, like Dr. Samer mentioned, it's form of the bacteria called Clostridium botulinums. Okay, this is type of the bacteria. The bacteria is resistant to the heat, but the toxin is not. So you have to store it in the freezer. This is very important and very crucial. Clostridium is anaerobe bacterium of a large genus. It can cause gas, gangrene, tetanus, a lot of things like food poisoning. Botulinum, it's Latin word called sausage. Like this, we have it in Egypt. Okay, so now I'm going to deal with something biological. I'm giving something to relax the muscle. This is biological, it's not mechanical. I'm not going to cutting anything. So this is give me something very, very attractive to the patient when we are treating this. The bacteria produce some serotypes of toxin, type A, B, C, D, up to G. So we write in botulinum toxin type A. We are using type A. Type A and B and E is a causative strain of human causes botulinism. This some animals is not affected by these toxins like dogs and chickens. Okay. Botox, it's type A and E and F and G. The history, it starts from the past, like Dr. Samer said. It's very, very, very in the past. This, it's drawn in the ancient Egyptians, and they describe something, it's called, by Hippocrates, it's called rhizus sarcoidonis. Rhizus sarcoidonis, if the patient has botulinum toxins inside his from the botulinum toxins. The botulinum toxin making paralysis starting from the jaw muscles, and the patient cannot open the mouth. The paralysis go down till it will reach the diaphragm. If it reaches the diaphragm, the patient die. The patient cannot open his mouth. And this also it's drawn by Crasci in Italy. This show how they can open the mouth of the patient has rhizus sarcoidonis. And this is also drawn in Baghdad. This person, he worked as a surgeon with the German army. He noticed that there are some the effect of the toxins, and this person can isolate the toxins. The history, the neurological effect is noted from the sausage. The bacteria is identified as a Botox. So if you are injecting this in the muscles, we are going to give the patient some relaxation. They try to use this for strabismus, the patient with strabismus, and they notice there are a great disappear of the wrinkles around the eye. They will get FDA approved to treat a strabismus blepharospasm, and they use it for several muscle dystonia. They get FDA approved for cervical muscle dystonia and for glabellar line and for hyperhidrosis. Okay, the botulinum toxins, it's types of protein, so it's very heavy. So please never shake it. You have to take care to avoid distortion of the protein. It's containing heavy chain and light chain. Let's see this cartoon. It will show us
botulinum toxin type A.
This cartoon show us exactly what happened by botulinum toxins. Botulinum toxin, it will affect the muscle. It will not affecting the nerve. So what happens if I'm injecting near the nerve? Nothing is caused unless I make a mechanical injury to the nerve. So this botulinum toxin attached to the acetylcholine receptors, so it will make relaxation to the muscles. I like to call it relaxation, not to call it paralysis. And this is very, very important and very crucial to help our patient, to convince our patient of using this material. This is exactly what happened of botulinum toxin. It will make relaxation to the muscle. So this bind to the neuroreceptors, so it will cause relaxation to the muscles, and later on there are metabolism of these proteins and the sensation will regain again. So when I give it to my patient, I told my patient you will find immediately after I inject Botox, you will find slight stretching. This is number one. And after a while, the effect, it's notes after 24 hours up to 2 days, and you get the maximum effect after 2 weeks. And after 3 to 4 months, you have to re-inject again to decrease the effect, because then your sensation will regain again. So it's very, very important and very crucial. Nerve connection will be established again, so we have to inject our patient again. Therapeutic effect of the botulinum toxin is seen 24 up to 72 hours. It will last up to 3 to 6 months. Okay. Does it cause complete paralysis? No. Let's see this cartoon. It will show us the effect, this before and after of Botox, regarding to the facial animation. Okay, always the patient ask me these questions. How does it last? And this is my answer. Your face will tell us. The average effect of the Botox treatment is 4 months. We have the material of the Botox and we have to use some material. We use saline. Can we use water? No. Why? Because it will be very painful of the patient. So I use saline to reconstitute the Botox. This is very important. How I inject it? I use insulin syringe. But I have to notice there are different types of insulin syringe. I have to use a sterile gauze. My secrets, I like to go for a painless injection for my patient. So I start to apply IMLA cream. IMLA cream, it's abbreviation of eutactic mixture of local anesthesia. Then I use after this is my secret, I use arnica cream or anti-bruising cream. So if I use this, I guarantee zero bruising for my patient. I use it after applying the IMLA cream. This is the insulin syringe. If you see this insulin syringe, this is a cap and this is a needle and this is a plunger. Very important, we have to look by the details. This is very, very important. This is saline. We use this saline. Botulinum toxins have different form. It's not unique types. We have number one. It's ONA botulinum toxin type A. ONA botulinum botulinum toxin type A. It's botulinum toxin by the company called Allergan or Vistabrils. It's up to 100 units. We have another types. The name it's OBO botulinum toxin type A. OBO botulinum type A, it's like Dysport or Azilur. Another type, it's called Inco botulinum toxin type A. It's Xenom I like this type. Why? Because it's not required for storing in the fridge or procures. Rheumatobotulinum toxin type B. It's most probably used by our colleague of neurosurgery. It's my block. It's 100,000 units. I don't use it in my private. Characteristic using of botulinum toxin products, very important. We have to know that our botulinum toxin is stored by vacuum driven. So I have to put the saline and see the plunger come with vacuum, not with by push. Some like this port, its method of stabilization by lymphoized. Another like xenom also the same, so it's need to be not to be in the fridge. My block by the liquid pH. So very important this value, Botox vial dilutions. This is my syringe, and this is a material. The syringe, most probably I prefer to use 50 units insulin syringe. The company is called BD. I like to use this. It's occupied by half ml. So if I put 1 ml of insulin, I can be diluted up to 2 syringe. So if I use 2.5 saline, I can reach to 5 syringe. So this what we call this universal dilution, and help me dramatically to get a safe injection without over diffusion for the Botox. Okay, let's see in details. We get this saline, and I like to use 3 ml cc normal syringe and make reconstitution. Let's go by details. Never shake. Why? Because if you do shaking, you will make denaturations of the proteins and decrease the efficacy of using Botox. We get this saline, this Botox. If you see this Botox, you feel it's like an empty. It's very important, the devil in the details. Never get the saline stream directly to the Botox. Why? Maybe you destroy it with the stream. See how can it come down? It will come with vacuum without pressing on the syringe. After you finish, you remove the plungers and keep it to evacuate the air. Never shake, please. Don't shake, just a gentle rotations. Now we have to put this fluid in the insulin syringe to get the safe injection in our patient. It's very easy job. This is Botox. We use 2.5 ml, 45 degree, and then the vacuum, and then the syringe and rotation, ready to use now. So the needle preparation, very important. We have to use this needle. Number one, you press to evacuate this tiny air. And after this, you will enter it inside to get the fluid in the syringe. So I have to evacuate it till I reach my target. Okay. You have to avoid this, what we call this foaming. Foaming, it means that you have a bad proteins and it will not work properly. I clean the patient and I ask my patient to reanimate before I inject. Okay, very important to see the needle. The length of the needle, most probably it will be, this is a needle. The needle, it's 8 millimeters. This is usual needle. We have 11 and we have 13 needle length. If we enter the full length, we call this deep. Most probably in TMD, we injecting deep. This is called superficial, and this is, it's considered very superficial. Okay, very important to have, if you are injecting with virgin needle, see the new needle. If you are injecting twice, if you're injecting 3 up to 6 times, you will get your needle sharp. So my advice, I like to use a virgin needle in every injection to decrease the pain during injection. This is what we call this virgin needle. How to inject? Very important to inject steady in the injection. You have to inject very slowly and very steady in the patient. I hold the muscle between my finger and I inject when the patient is relaxing. If you're injecting like this, you will get the fluid in the floor. So this, the safety technique, it's called joy technique. It's invented by my friend Dr. Haider. If you're injecting like this, you'll find the fluids like this. It's very bad. So what do you think of the ideal technique of the injections? The right technique, it's called joy technique. It's invented by my friend Dr. Haider in Jordan. He put his finger like this, and when he inject, he transfer his finger to the plunger to facilitate the injections. I like this technique and I prefer to use it in my patient. This providing you is very, very safe method of injections. How to avoid uncontrolled diffusions? Not all botulinum toxin are same. Don't use a higher concentration and go very slow and minimal finger pressure, and very important to ask your patient not to do massage. This is different between Botox and Dysport. See the difference in diffusions. Using Botox, you have to know the facial muscles, very important. I like the first part from Dr. Samer lectures. He focused in the anatomy. It's very important. If you don't know the anatomy, you don't have to work. Let's see the anatomy. This case, I show you, I do in this, for this patient, facelifting. Facelifting to stretch the edge. Let's see exactly this part. I elevate this part. Let's see exactly what I am going to do. So we have the skin, subcutaneous, musculoabnorrhetic system, ligaments, and deep fascia. Our forbidden area in the Botox, it's the periosteum. So my aim is to get the proper effect for the Botox to reach the muscle. What happens if I'm injecting in subcutaneous? Does it work? Yes, it works, but not properly. So this is very important. Or maybe you have diffusions to other muscles and cause complications. This another case I do for that patient. Do tray to repair dislocation. Let's see this, the muscle. This, it will show us the depth of the muscle, and this is after doing the tray. I revise the muscle very fast. This muscle is called buccinators. It's make the tension of the cheek. So if you are injecting in this muscle by mistake, you will cause a problem to the patient. The patient will not able to blow. This is the muscle. So it's very important to get your injection slightly near to the angle. Temporalis, it's very important. This temporalis muscle. Let's see this video. It will show us when the temporalis is contracted. This EMG, I like to do it to my patient. This is enabling me to determine the triggering point of the pain. It's called EMG, electromyogram, for the muscles. It's helped me dramatically to get planning for my injections. And sometimes you can use the guides to help you in during the injection. Masseter is the most important muscles in the myofascial vein. Actually, most probably we are injecting in the masseter and we injecting in the temporalis, most probably to treat atrismus patients. This is the origins. I don't like to repeat the previous lectures. Okay, but always remember very important things. When you inject, you have to inject while the mason is relaxed. This device, I like to use this device. This device is called acrostigma. You can fix the patient and ask the patient to chew. And this is useful for tracing the motions and tracing the range for the mesh and make stimulation. It's called visual articulating for the patient. It's called 3D skull simulations, and it helps you dramatically before you do something like night guards, and it's help you dramatically when you treat the patient of myofascial pain or any abnormal jaw motions. So it will show us the abnormal muscles like tics or dystonias. Okay, now I speak about the materials, the Botox itself. So now I show you how we can dilute it and how we can use this. Now I jump to another important part, the techniques. How can I inject it? In TMD, all this we can use botulinum toxin to treat a myofascial pain, to treat a paroxysm, to treat a oromandibular dystonias, to treat a headache, to treat masseter and temporalis hypertrophy, and treat a trismus, and to treat a myofascial pain secondary to the TMD. If you see this by age, we have this very beautiful V, and by age and increasing the paroxysm and also by sagging of the face, you will reach to the very bad appearance and inverted V. By injecting of the botulinum toxins in the masseter, you get slight reduction to this muscle and get a pleasant appearance for the patient, and get a treatment for masseter hypertrophy. Where to inject? I inject directly in the masseters. I will show you exactly what the cookbook of this. Before you start, you have to make a proper diagnosis for your work. This is my previous presentations. Actually, I like this photo. This is her name is Cleopatra the Sixth. She's from Alexandria and she's famous of the headache. And they write a very famous papyrus stored in Germany, and stated how the ancient Egyptian treat the headache. They think that the headache come from the evil inside the head. Most of the headache, by the recent science, as most of the headache can cause by muscle contractions or blood flow problems. So by injecting these neurotransmitters or Botox, you can help dramatically to improve the muscle contractions. This papyrus stated how our ancient Egyptians can treat the headache. They get alligators ligating in the head, this is some ancient, and they do scalp trephination in the terion to remove the excess blood. But the problem in this method, the half of the patient, they are die from the treatments. Actually, this muscle headache, by injecting our material, it will relieve it dramatically. Will you think Botox can help migraine and myofascial pain? Yes, the answer is yes. It's get FDA approved since 6 years and approved for chronic migraine, and the insurance company can still don't like to pay for this. There are a very strong evidence-based, like Dr. Samer mentioned, supporting you to doing this. Where to inject? Depend on the triggering point, as we stated in the previous video. We're injecting in the frontalis muscle. We're injecting the corrugators in the procerus, in temporalis, in trapezius, in cervical paraspinals. This depends on the triggering points. Okay, there are another device. It's called MyoGuides. It helps you dramatically when you inject. This machine, it will show you the triggering point for the patient when you're injecting, and I show you in the last slide how can we use this machine to help our patients. This machine had two parts. We can use it to help us during the injections. This pad is put on the patient. And it will show you the exact part when you inject to provide a very safe injection to your patients. Okay, this example of the corrugators, we inject classically this injecting the procerus, and this is in the frontalis. In temporalis, very important, we're injecting 5 units on each site, up to 6 sites. Occipitalis, we're injecting 30 units divided into 6 sites. Cervical paraspinal, we're injecting 20 units dividing into 4 sites. Trapezius. This is one of the very famous bruxers, by the way. See, in the bruxism. Okay, in the bruxism, most probably we are injecting in the masseter muscle, like this lady. I like to put these lines, this line preventing me from going up to this site to avoid injury. Injecting in the anterior muscles around the oral cavity. And after I finish, I put anti-bruising cream. If you inject like this, you'll get very good roundations, like this case. And this is after, like this lady. This is major case, injecting hundreds units in each site, and I get this perfect result. This person. It's very easy and very convenient. Just you injecting Botox and ask the patient to come after 2 weeks to photography. It's very easy. Bruxism, it's very important. You can help the patient with clinching, like this patient. Patient with masseter hypertrophy, like this lady. It's very important, very crucial to get a slimming for the face. Finally, this most probably come with minimal complications. The complication most probably it's in the Botox is not related to these issues, related to the cosmesis, like over and under corrections, upper eyelid ptosis, dysphagia, neck weakness, perioral drops, globe perforations. This is not seen in our specialty. This, if you are injecting Without plan, you will get something like this. Maybe if you are injecting too anterior, you get this lower lip sag. Finally, the conclusion of these methods, it's very convenient. You have to make a dilution for the Botox, and it's very easy. If you do the proper technique. Plus also it's evidence-based and come with very minimal complication to our patients. I like to put these stoppers when I'm injecting for my patient and apply a very gentle pressure during my injections. Okay, thank you so much for your time, and thank Dr. Samer and Dr. Mazin for your kind invitation. Now I'm ready for the questions.